The next question's around indicators and measurement. So if some of these common measurements like TRIR, LTIR, et cetera, are statistically meaningless, at least from the use cases that you presented in your report for predicting SIFs, what should we be measuring instead of those sort of measures?
It's the $1 million question. I do a lot of speaking in board meetings nowadays, and they want to hear about the company wants me to tell them that recordable injury rate's terrible, and of course the first question that the board members come back with is, okay, now what am I going to do? I advocate for not just throwing lagging indicators away and saying, don't do lagging, do leading, or something along those lines. I think what we need to be better at is moving towards a set of metrics, and I mean a set of metrics that give us information that better explain why we get our long-term lagging indicators that we get. So, TRIR or TRIR is invalid over short periods, but if you roll averages and you take enough time and aggregate the data to a level, the trends can have some meaning to them. And I think what we need to do is have some other measures that are more leading or monitoring sense that help us explain the ups and downs. Because I think a lot of executives kid themselves if they can explain the small ups and downs they have in their recordable injury rates. We can explain our way through anything given the data, but whether those explanations are true or not is suspect. So I think I'd look at a balanced way. So I'm kind of giving you a non-answer. A good question. We've been working on it. So things like measuring the quality of our activities and the presence of controls, but there is no form, response where we have something that's working right now that everybody can use and it's standardized and benchmarkable and all of that. There's work to be done in that space.